concerns about reports that foreign nationals are being denied essential medical care. The Commission says that this practice is unethical, unlawful, and violates both the South African and international human rights. It also warns against the growing instances of individuals taking the law into their own hands by blocking access to health care for those they seen as, quote, outsiders. The South African Human Rights Commissioner, Sandra Makwashe, is now joining us to unpack this further. A very good morning to you, Commissioner. Thank you so much for making time for us this morning. Why did the Commission feel that it's important to issue the statement and also clarity around your interpretation of what the Constitution says?
I think the Human Rights Commission saw it important to do so given the rise in people being denied access to healthcare, but also to remind South Africans of the law and reminding them not to take the law into their own hands. But also, as the Human Rights Commission, our mandate is to promote the observance of human rights, but also educate people on where those human rights stem from. So we did so to remind the general public that in terms of Section 27 of our Constitution, everyone within the borders of South Africa has the right to healthcare and access to healthcare.
Hello everyone, my name is Connie Malinga. Welcome to MzansiOz-Justice Unmuted. South Africans are tired of long clinic lines, overcrowded hospitals, and government that seems unable to say enough is enough. But what if I told you that the reason the system feels overwhelmed isn't just mismanagement, it's the Constitution itself?
Yeah. And as you've seen, maybe with the statement that has now been issued by Action SA, their argument is that there is an abuse of Section 27 of the Constitution. They go on to say that in May, Action SA submitted a suite of proposed constitutional amendments aimed at overhauling key provisions. What's your understanding around this? Because this also influences how their own followers understand what the Constitution says and what is expected.
What takes place is that when political parties do not actually, or members of the public, do not actually deal with the systematic issues in the general public healthcare system, then we have this issue where we are fighting, or the general public is fighting for limited resources. And these systematic issues speak about the aging infrastructure in healthcare, the high levels of vacancies, of course, and the unavailability of medication when people go and get healthcare services in clinics as well as hospitals. So those are the systematic issues, and the amendment of the Constitution won't address those systematic issues. What will take place is we hope that in terms of the National Health Act, those systematic issues are dealt with, but also we have financial backing to the Department of Health to ensure that everyone who's entitled to healthcare is given healthcare.
Yeah. In light of what you've just said now around the limited resources being available, is there, though, a case to be made that on the basis of those limited resources, and I think there's common cause around that, that perhaps maybe it is too expensive to implement the ideals that are in the Constitution, and therefore we may need to revisit it?
Based on that, it's not about the Constitution. Once you start amending the Constitution, which is founded on the values of dignity, humanity, and the underlying principle of Ubuntu and treating people with those the same way you would want to be treated, that doesn't deal with the systematic issues. Amending the Constitution won't immediately give everyone access to healthcare, everyone else access to adequate education. And that is why the Constitution speaks about the progressive realization of these specific rights. So it won't really deal with the systematic issues, these amendments. It will simply mean that we're amending the Constitution, allowing certain people to have access to certain rights, and therefore, because of the way the South African borders are, allowing those who really need our help, the most vulnerable members of society, to then suffer because of these amendments.
Yeah.
Right now, South African Constitution says everyone has the right to access to healthcare services. Sounds good, right? But here's the problem. Everyone includes illegal immigrants, even those who cross into the country illegally. That means someone without papers, without tax number, without legal status can still demand the same health care as citizens of South Africa. And this video is not about hating immigrants or hating anyone. That's the disclaimer. It's about healthcare access and resources that are limited in developing countries like South Africa. Many come from desperate situation, as we all know about the situation in Zimbabwe and other neighboring countries. But when South Africans who pay taxes and they vote and they build South Africa, the country, are made to compete for basic services, it's not just justice, it's actually neglect. And the truth is, most countries don't do this anyway. They don't do it this way at all. Most countries don't do it this way. I live in Australia. I'm a migrant, South African migrant. I came to Australia in 2006. So I've been here for a while. So I'm a citizen now. And I'll tell you now that, most countries don't do it this way. South Africans, they don't. So in the UK, for example, undocumented migrants or illegal migrants, they pay for most public services. In Australia, my second home, you need permanent residency to access Medicare. That it was the same to me as well. I had to, when I was a skilled migrant coming in Australia, and I had to pay until I became a permanent Australian resident. Then I had some access to Medicare. So this is not something kind of like, South Africa is so inhumane for not giving immigrants. When you hear from these human rights people, it's because healthcare, we know it's very limited resources around healthcare. They're limited resources, and we need to look after them really well and make sure we don't abuse those resources. So that's why. It's not because, people are inhumane. No, that is completely false, and we should reject that. Around that, we should acknowledge that all countries have resources, and those resources are limited, and some countries are faring really well. Some countries are really having a really difficult time, and there's that disparity as well in most countries. That's very important. As a healthcare worker, I told you guys I'm a physiotherapist, and also I told you that I have pharmacy. I'm a pharmacist, physiotherapist, pharmacist, and I'm also a chemist, meaning I do a lot of research around drugs development and so on. And also I'm a business owner, so I know this stuff. Alright, so in Botswana, public hospital charge non-citizen for all care. So that means in Botswana, if you were to be sick, when even going to a emergency, if you're in emergency, you will still be charged for everything in Botswana. It's just not saying that, okay, because it's emergency, you're not going to be charged. No, you're going to be charged. So these countries, all of these countries do respect human rights, as I said, but they also know the difference between emergency care and unlimited free access. What that does sometimes, then you see the situation that we're now seeing in South Africa. So why can't South Africa do the same? That's a good question we need to ask. Why can't South Africa do the same? Because the reason that why South Africa couldn't do this is because of South Africa's constitution. Our constitution, South Africans, it was written after apartheid with the best of intentions. It was the best intention to do that after the apartheid system, where the UN, they refer to this institution as the crime against humanity. So it was declared a crime against humanity, felt also being the G word around it. But it says everyone has the right to health care, housing, and education. That is what this constitution says. It was drafted by the ANC, and it's the biggest, priority thing for them, and for good reason why they'll be proud of it. But in practice, this whole thing around everyone creates illegal loopholes. It's illegal. Everyone is illegal. Like everyone who lives in it, everyone who belongs in it, it's a legal loophole. So because now clinics, even under-resourced communities, are forced to serve everyone, even if they can't afford it. Even if they can't afford to do so, because clinics do come with a budget. And when you like South Africa, where you got so many undocumented people, then that budget is useless.
But again, Commissioner, isn't there a case to be made when we speak about the suffering of people, that amongst those people would be South Africans as well, the same South Africans that would have gone to the poll to go and cast their ballot, that gives legitimacy to the politicians who are currently governing the country. But what they find is that you have longer queues that are at these health facilities because government needs to also provide the service to foreign nationals, and the pressure that it applies on the healthcare system as well. So South Africans themselves are being disadvantaged by the Constitution.
South Africans are protected by the Constitution, and that is why we have a constitutional democracy. The difficulty then is hiding behind the Constitution and saying it is the reason why we are in this dire situation, instead of addressing the real systematic issues. And this is why the Commission is reminding South Africans of the importance of our Constitution and the importance of adhering to that Constitution, as well as the legislation that stems from this Constitution.
All right. Again, that point goes back to the limited resources. This morning, we are asking our viewers around who should foot the bill in case an undocumented foreign national wants healthcare in South Africa. And this is now looking at the current provisions of the country. Who should be responsible for covering healthcare costs of illegal immigrants in South Africa? The first option that we have there is the South African government, which means that the South African taxpayer, essentially, their own countries, the countries of origin. 88% of our respondents have voted for that. NGOs and donors, 2% are saying that, and free emergency care, 1% are voting for that. And we know, of course, that the Constitution already covers that part as well, around free emergency care, whether from a public healthcare sector or the private healthcare sector. But there is an issue around who should foot the bill. And I remember the former Premier of Gauteng, David Makhura, had also raised this as well. What's the South African Human Rights Commission's response to this, seeing that in other countries as well, there is an expectation that somebody must foot the bill?
The conversation about who needs to be footing the bill needs to take place in terms of the regions. And as you said, that there is, in some countries, there are laws that say that the governments must then foot the bills for their citizens in those countries. And that conversation needs to take place between the South African government and those governments that are affected by this. So that conversation needs to take place. But in the interim, you can't have vulnerable members of the community, you can't have children not being given access to healthcare simply because of their nationality.
Yeah. Is the Human Rights Commission looking at taking any action against these individuals at all? We know that the Kopanang Africa Against Xenophobia had taken Operation Dudula to court as well. We're just waiting for a verdict with regards to that.
In terms of taking, we have joined in that case. We provided RS submissions, and we're just awaiting the judgment from the court.
All right, but no other action that the South African Human Rights Commission would be taking at this point?
At this point, we will be investigating. We will be receiving individual complaints. However, the Commission has always been monitoring the healthcare facilities across South Africa. We have been speaking to the respective MECs regarding the high levels of vacancy, poor aging infrastructure, as well as how do they have an action plan to remedy those issues.
All right. Thank you so much for your time. Sandra Makwashe is a commissioner with the South African Human Rights Commission on the state.
Court cases are brought by undocumented immigrants, illegal immigrants, as you have heard from human rights. Now they are in this case again in South Africa, where a clinic serving low-income, poor community, majority black community in South Africa has been limiting access to undocumented immigrants. So they're going to court now to try and fight these illegal immigrants who come into their services. The service is already full. The nurses are overworked. But because these people are undocumented, because if you're a healthcare manager, you need to plan for this. You need to know how many doctors you need, how many physio you need, how many pharmacists you need. You need to plan based on the user and the services, and also the prevalence of conditions and disease that you have, so you can provide equitable care for everyone. But when you have an influx of undocumented people, and then you have a law that says everyone, so you can see why this is a very charged situation around these undocumented migrants demanding free access to healthcare. It's not just access, it's free access. So what they didn't say in this interview is that they didn't say that really clear. This is people demanding free access. Not just because they are denied access, it's free access. They demand free access as the poor black community who the government had said, because they are unemployed, they don't have any resources, they can, some service need to be free for them, but they're competing against those communities. So if really, when you look at that, it's not fair, it's not sustainable, it's not fair, it's not sustainable, and actually it's time for a change. It's time to look at it very closely, that this cannot continue. Cannot continue because we do not want to provide care for people. We do, but like I said, healthcare has the resource around it is limited. We must be really always safeguard any access, make sure that it's used, the service and fundings are used equitably, that it's not going to misuse it and increasing more access for people demanding one sector and leaving other community underserved. So it needs to be distributed really well across the board. So the solution really, as I said during that submission of the amendment of South African Constitution, that it needs a cause. Everyone, we just must find and replace everyone with South African citizens and lawful resident. It's find and replace South African citizen and lawful resident, meaning lawful resident would be people who are migrants who've got either asylum or other documentation that for them to be in South Africa. Not those one who don't have any documentation, those who are illegal. So we need that constitution to really be tight in the language, not to be so loose. This loophole created by none other than the ANC. This is why we're here. So that everyone and lawful residents, they also have the right to access to healthcare, because this is a human right issue. All right. So Other may still get access. It doesn't mean that you can just say, oh, undocumented people, it's okay. No, they need to have access to, some kind of access, but it's really restricted, but they still have. And I'll tell you why it's very important to consider around that, because of the public health issues around, and we saw that around the COVID. Public health issues, very important that part of it. It's really examined, because things like TB, you really need to make sure that everyone is screened. Doesn't matter whether a person is migrant or not and undocumented, because you don't want people to have that inadvertently. So that's quite important around that. So that's why we still have to allow some access, including emergency care, because we believe in dignity. But chronic care, like you see in these clinics where people are full, they're lining up because it's a chronic disease management, housing and schooling, that one should prioritize legal residents, including the citizen. And that's not a hate. This is responsible governance. It's responsible governance. It's also responsible nation building. So that is important, that the DNU is the DA minister. They should not stop with this ultimatum. They'll be out there and really fixing this problem created by ANC and make sure this thing is actually working for everyone. So, because if we don't act now, my concern and my biggest fear is that if this is not fixed right now, we risk collapsing one of the best healthcare that money can get you in South Africa, in Africa. The world's best, one of the best healthcare if not the world best in Africa, which is South Africa. It's not just of services, but of public trust. Public trust is just so important. All right. This is about, it's not about turning our backs on the world or on the African community or African brother. It's about fixing the system and putting South African first without shame, also without apology, and ensuring others do take that very responsibility. Because each and every government in Southern Africa is responsible for their citizens. I did a profile around migration and how this migrant gets into these countries. And one of those things that I found was that it's a lack of governance, it's a lack of responsibility of the government that these people are coming from to provide these basic services. These tend to be the push into these countries for people taking these journeys and become these victims of human trafficking with the promise of a better job, and they lured into this criminal scam. And because they lure it, because there's a lot of push factor from where they're from. So if you support this, like, share, and also comment below. The people of South Africa must be heard. The marginalized and displaced people, they must be heard. And it's time that all government focus on the South African citizen. The South African government focus on the South African citizens and their safety and also the access. Those access are reserved for those citizens, for all citizens and legal residents. And that is important. And like I said, even here in Australia we do that. The access is limited for certain people, certain visa subclasses. UK is the same. This is not inhumane. This is about limited resources that are scarce globally, that must be used equitably among citizens and legal residents. Because we know that a lot of these things is that when you have a lot of these illegal undocumented people, it's a burden, because they're using the services that haven't contributed to it because they don't pay tax. Okay, that's a problem. They don't pay the UIF, which is unemployment benefit. They don't pay insurance around And then if they get injured, then they're responsibility of the state. That on its own, it's a problem. So this you can see how problematic the laws of South Africa as a whole brought by the ANC. So now that with this multi-party alliance, it's time for you all stop fighting like the Real Housewife of union building, and get there and work and provide services and try to fix this mess. The Constitution is the biggest problem for all of us, and we must fix it. And it's not fixing the Constitution. It's not because it's xenophobic. It's not because it's anti-migrant sentiment. It's because South Africans want the best services, because we know what it looks like to live in a better services. We demand that services must meet the expectation of communities. Thank you guys for listening. Until next time, see ya.